just a couple more minutes to join us. Just wait about 1 more minute, 1 to 2 more minutes, and then we'll get started. Okay, so hopefully you've all put your name in the chat, so you can get credit for tonight's meeting. And my name is Stacy Copso. I'm your instructor for this semester. I have been registered in radiology since 1993. I have been teaching since 2011, and I am a full-time mammotechnologist. So I'm back in mammography. I had been out of it for quite a while. And when I decided to switch back to clinical. I was a program dean for many years and adjunct professor. And then I decided I wanted to get back into clinical just for a more flexible schedule. I can just, I do 10.5-hour shifts, so I don't have to work 5 days a week. So I decided to go back into mammography because it had been a long time, and I'm glad I did. I actually really enjoy it. It's a very relaxed environment. So I'm about an hour. I'm an hour ahead of you guys, so it's 7:30 here, and I just got home from work at 7 o'clock. So we're going to be going over the syllabus. This is a kind of like an advanced radiology pathology class. The boards are not heavy in pathology, but it is required as part of the curriculum when you're in an associate's degree program for radiology. We have kind of revamped the course a bit. We're focusing now on pathology that is common, that being in the medical field, you will hear about, instead of a lot of the advanced pathology. Because I believe you guys are probably close to graduation. If somebody wouldn't mind chatting, throwing in the chat how many courses you guys have at this point before you graduate, so I can kind of understand your level of where you are. If you just wouldn't mind putting in the chat, if you have 1 or 2, so 3 more, including this one. Okay, so you are pretty close. So some weeks when we cover an actual system like gastrointestinal, I will use that opportunity to review everything about the gastro system in relation to registry review. Okay, same thing with urinary, any other, things. Anytime we cover an area that will have a good section of it on the boards, I will incorporate that into my live session as far as, okay, let's just kind of review quick, what anatomy we have to know for that system and what type of questions they're going to be asking us about that. So, which is typically going to be fluoroscopy section, right? The whole gastrointestinal and urinary system is all, going to be questions about the exams, what they're going to be doing during those exams. What is it for? What do you see? What type of contrast is used? So we'll take that opportunity to do a review as well of that system for the boards. Okay. So hopefully this course won't be too overwhelming for you. There will be a lot of pathology in the chapters. During my live session, I'll kind of break down the common pathology, and we'll focus on the common ones for the quizzes and exams. Okay. Typically, what's asked on the boards is more or less, how would you adjust your technique for this pathology? But as far as, real life and clinical, you need to have, an idea of what these pathologies are and what you're going to look for in an image. So can everyone see, just a thumbs up if you can see the syllabus on my screen, please? Let me know in the, good, great, okay. All right. All right, so as far as the syllabus goes, you can review all the objectives. I'm pretty sure you guys are probably following the same suit for the rest of your classes. Assignments and quizzes are 80%, and the discussions are 20%. Remember, with the discussion, the key things are posting your initial by Wednesday midnight and replying to 2 classmates by Sunday midnight. When you reply, just try to carry the conversation, mention something in the textbook, elaborate a little more on their post. And please make sure that you put in-text citations, because basically what an in-text citation is you wrote something, you wrote information that you had to use a textbook to get, okay? So if you write a whole paragraph about a pathology and you didn't just have that in your head, then that means it needs an in-text citation at that end of that information, as well as then when you are done posting, on that bottom right there of your post, you will put the full reference for that in-text citation. Stick to the pathology textbook that you have, okay? Just, that makes it simple. Use your textbook for the information. If you need to, then, you can use another textbook, but you really want to stick to the textbook. And I've included the formatting for the textbook. I think it's on the homepage. I think I put it on the homepage with the course information, okay? So that you know how to properly reference an APA format. As far as submitting things, your assignments and quizzes are always due by Sunday midnight as well. And there's a 5% deduction if it's 1 to 2 days late, and a 10% deduction if it's 3 to 6 days late. I can't tell you how many students towards the end, they wait until they get to the end and they realize there's a chance they may not pass, just usually because they didn't get things done in time. And they had that big deduction, especially for discussion board. You're going to get a deduction if it's late, and then you're going to get another deduction if you didn't write on the rubric. There's an area, didn't meet the timeline, so didn't meet the deadline. So that's another deduction, as well as points off if you didn't reply. So it can end up being a lot of points off. And, there's nothing hard about writing a discussion. It's just a little time consuming. I'm not a nitpicker when it comes to the discussion, as long as it's an educated post and you did your in-text citations and your referencing, and showed your knowledge, it will be fine. You don't want to end up losing points off for things like discussion because, maybe the quizzes are going to be hard for you. So if that's the case, you want to gain all your points in your discussion post, okay? And as you know, the grading scale, this course is the same. You need an 80 or above to pass the course. Any questions? And obviously your tests are going to be in the lockdown browser with the webcam, okay? But I'm sure if you only have 2 more classes left, you're familiar with that. Any questions on the syllabus? You could just give me a thumbs up or type your question. If you have a question in the chat, please. Okay. All righty. So this first week is just an intro to pathology. So there's really not too much to cover. I was asked to just review some terminology with you guys. So we'll do that in the beginning of this. Okay. All right, sometimes students have a hard time with labeling oblique positions. And you just have to remember with oblique positions, you're gonna name it whatever's touching the IR. So in this situation with this gentleman here with his back against the IR, you know that's already going to be a posterior oblique because his posterior side's touching the IR. And then it's his left shoulder that's touching. So it's going to be a left posterior oblique. Okay. Here you see now his anterior side is touching. So that's going to be an anterior oblique, and his right shoulder is touching. So that would be a right anterior oblique. And as you know, an REO and an LPO will show the same thing. That will help you when it comes time for large bowel, colon, barium enema type of fluoro questions of what's demonstrated. You really only have to remember the posterior obliques because then you know that the anterior oblique will be the same. An LPO equals an RAO, and an RPO equals an LAO. Okay, same thing with on the table, her back is touching, so we already know she's a posterior oblique position, and her left shoulder's against her, so she's in an LPO. This female patient, her stomach is closest to the image receptor, so she's an anterior oblique, and her right shoulder is touching the table, so that's a right anterior oblique as well. With decubitus, you want to know, once again, this is a left lateral decubitus because she's on her left side. Whatever you tell the patient to do, that's the name of the decubitus. This patient's on his right side, so that's a right lateral decubitus. This patient's on his back, so the terminology for back is dorsal, so that's your dorsal decubitus. And this patient, you told him to lay on his stomach, which is the ventral aspect, so that's a ventral decubitus. Relationship terms, lateral versus medial. Okay, the medial plane, your mid-sagittal plane, anything that's closest to that is medial. Anything furthest away from that would be lateral. So when you're moving away from the medial plane, it's lateral. When you're moving towards the median plane, it's medial. When we look at the trunk of the body, proximal is closest to the trunk, oops, sorry, and distal is furthest away. Remember, when you're answering questions, you have to put yourself in the anatomic position with palms up before you can answer that, especially with extremities. So that's just showing you there in that lateral rotation, he is moving away from the midline. Abduction versus adduction. ABD is when you take it away, just like abducting a child. So ABD means away from, versus adduct means towards. This is a common question for elbow when they're asking positioning of the elbow. Okay, supination is going to be, they have their palm up. So like for the AP elbow, the palm is supinated. When you do a medial internal oblique elbow, the hand moves into pronation. Any questions with terminology? Reviewing that just short terminology there. Okay. All right. So let's just look at some intro stuff here from your chapter. All right. They've got a few terms here related to diseases, Couple that stand out, idiopathic. That means the underlying cause of the disease is unknown. Okay, that's an important term there. You know, a lot of these you already know, prognosis syndrome. Then there's heterogenic. That's a disease caused by the physician or the treatment. So it would be something like the patient had a lung biopsy and ended up getting a pneumothorax from the biopsy. Okay. Nosocomial infections, those are infections that were contracted from the hospital. Common one is your urinary tract infection, UTI, which is usually common from catheterization. Inflammation, which is your initial response of body tissues to local injury. Your 5 clinical signs are going to be redness, heat, swelling, pain, and sometimes loss of function of that area. So make sure you can recognize the clinical signs for inflammation. I won't quiz you on the other words. I'll just quiz you on the regular words. Edema. This is a very common pathology. Edema is the accumulation of abnormal amounts of fluid in intercellular tissue spaces or cavities. So that is typically common for us to see when we take chest x-rays. We'll see the pulmonary edema. You can see all of these, all of the increased lung markings and that fluid from the edema. Remember, edema is fluid. Fluid shows up white on an x-ray. So therefore, because of its thickness, you would have to increase your technique if your patient has fluid/edema in it. Ischemia is an interference with the blood supply to an organ or part of the organ, so it's going to deprive it of the oxygen. This could be caused by atherosclerosis or thrombotic occlusion or an emboli, anything that's then going to stop that blood supply to the organ. Hemorrhage. Hemorrhage is a rupture of a blood vessel that allows the blood to escape either externally or internally with surrounding tissue. So bleeding into tissues results in hematomas. You'll see this is a CAT scan of an intracranial hemorrhage here. You see that white part is the blood that has hemorrhaged in. Okay, some more terms here. Atrophy. That's going to be when there's a reduction in the size or number of cells, and there'll be a decrease in function. You'll see that a lot when patients are bedridden or they're in the hospital for a long time, and then they're trying to get out of the hospital and they've got to go to, a rehab home because a lot of their muscles are in atrophy. They need to build up that muscle strength so they could walk and, use their arms, their muscles again. Hypertrophy right away, that's an increase. So that's if there's an increase in the size for demand function, like when the heart, an enlarged heart because it's working too hard. Benign and malignant. I'm sure you know that by being in the healthcare field. Benign is negative, right? It resembles its cells of origin, but malignant is when neoplastic growth invades and destroys the structure. So malignant is, you're cancerous, carcinoma, cancer causing there. Metastasize, that's when that malignant neoplasm the malignancy travels to different sites. It's not good. Sarcoma is our highly malignant tumor originating from connective tissue. We'll go into that in other chapters as well, but just remember that term. So remember your atrophy, hypertrophy, benign, benign and malignant, you already know. Metastasized, carcinoma, sarcoma, okay. On this slide, it's really the staging that I'm mainly focused on, just because you hear that a lot. So when they say, oh, she's in stage 4 cancer, when they talk about staging, they're going, from 1 to 4 of the extensiveness of the tumor and the presence to see if it metastasized to lymph nodes or other organs. Okay, so a lot of cancers are put into staging categories, so you know how aggressive the cancer is. Hereditary diseases, those result from an abnormality in the DNA, so they're going to pass from one generation to the next through that information contained in the nucleus of the cell. Antibodies, that's your immunoglobulin responding to the antigen, okay? Your antigen was your foreign substance that evokes that immune response. Your vaccine is when they put you into contact with dead or deactivated microorganisms to form antibodies for that. Anaphylactic reaction, that's one of the most common ones we talk about in radiology out of all the shocks, because that's a hypersensitive reaction from a foreign substance. And when we inject the contrast into the patient, whether it be CT, MRI, or any floral that urinary IVUs that have contrast, there's always a chance that they can have an anaphylactic reaction. For the board, you will go into the different signs of anaphylactic reactions as well. Oh, okay. All righty. Any questions? We've got a short quiz this week, since it's really just more intro material. Use these slides to help you with the quiz. So you'll have a short quiz that's due by Sunday midnight. Make sure you did all your pre-module in order to get into that module 1, and take that quiz by Sunday midnight. And then next week we'll be moving into skeletal system. Okay. Any questions for me?
Question.
Mm-hmm.
So when we were talking about the fluid, like say the brain or whatever, blood, is that considered fluid, or is there other types of fluid that could accumulate? Or is it just blood?
It could be blood. No, it could be water. They could have a lot of water retention as well. A lot of times, especially if they're getting a lot of IV. Have you ever seen a patient that, well, it's more in the hospital, probably if you're in clinical, and you'll see them too with a lot of intracellular fluid from the IVs. Okay. Yeah, they could back up, like if they have CHF, congestive heart failure, they could just be backing up with fluid. Okay. Thank you. Any other questions? Like I said, this is more just an intro. Almost like, I'm sure the chapter is probably more like an anatomy and physiology intro, but For weekly quizzes, is it sufficient to do just slides? For studying, you mean, purposes? Yeah. Yeah, I mean, I'm gonna try to be clear because your textbook is so extensive with pathology in it. I will try to be clear as to what to focus on for the quiz. Um, you know, this isn't my first time teaching, so I understand how frustrating it can be when you have hundreds of pathology and you don't know which ones to focus on. So read the chapter so you have the knowledge, for the discussion board, and then when you're ready to study, just kind of review what I said to focus on for the quizzes.
I have a question over an assignment.
Mm-hmm.
Um, for week one matching, I read that there's two activities, but I only see, I'm guessing for chapter one, Intro to Pathology Matching,
Okay.
and then it says, um, and then chapter two, Skeletal System Matching, but I don't see that one.
Okay. So you're seeing that located where that it said the two, because we revised this course this term, so
Oh,
some of this stuff may be messy.
yeah, it says on week one matching and on the description.
Okay, so I gotta figure out how that's still in there. That's under assignments. All right, yeah, let me look into that. Trying to- Yeah, because it used to be last term, it was intro to pathology and skeletal. So I moved it, so it's just intro to pathology, but I must have to move it somewhere else then to remove it from somewhere else. So I'll look into that. Hopefully I can figure it out tonight. If not, I'll have to send it to your program director or IT to figure out how to get it out of there. But it'll just be just the one intro.
Okay, thank you.
Welcome. Just wanted to see if I could get it on. That's fine. Any other questions? Also, I don't know, you're pretty far. If anyone has a subject area, since you're getting close to the boards, if you only have 2 more classes left, if anyone has a subject area that they feel weak in, I can send you uh, um, like a board outline prep for that section, because I have a great outline prep, which basically kind of covers the type of, what questions they're going to be asking you about that section. So if you have a topic that you're like, oof, I'm still feeling pretty weak on that, you can shoot me an email and I'll provide you with that section of a little board prep if you like.
Also, how many questions will this quiz have? You mentioned it was short.
It should say, yeah, doesn't it, when you look at the module, I'm trying to get into the module. When you look at the module, does it tell you how many points? When you're in week one and you go down to the quiz, does it tell you, can you see how many points it is?
Yes. Thank you.
Okay, yeah. So just so you know, so moving forward, I just want to make sure you could see it on your end. I know I could see it on mine, but I wasn't sure if you guys could see it on your end. Yeah, so you'll see there, it says 19 points, so it's 19 questions. Okay. So you said the matching was showing, yeah, I gotta figure out what that is. Because in the module is only one, okay. Any other questions? Okay. All right, well, if you don't have any questions, I'll let you guys go. I'm sure you've all had long days as well. I'll upload the recording tomorrow. It usually sends it to me and then I'll upload it. So if you need to review back, the recording will be up. Any questions you have, you can email me. I have the email on my phone. For my Google, my phone number, for some reason, I never get alerts on my phone. So I respond quicker to email. Okay. All right. If you don't have any questions, you guys can sign off. And you don't have to put your name in the chat again, as long as you put it in the beginning. And then we'll meet again next Monday. Okay. Have a good night.